Hi, I'm Attorney Ramsey Bahrawy, and this is Your Money, Your Life. Today our topic is navigating the Affordable Care Act. Assisting me in this discussion is Lainie Messina. Over the past 7+ years, Ms. Messina has worked in the healthcare industry, which has experienced tremendous change as a result of the Affordable Care Act. She's currently a consultant in the healthcare industry, working on a variety of projects with large physician practices, home care agencies, hospitals, and insurers. Her passion is to help organizations to enhance the patient experience. Prior to her entry into consulting, Ms. Messina was the Vice President of Private Care Services for the Visiting Nurse Service of New York. In this capacity, she interacted daily with healthcare professionals, family caregivers, and clients. Ms. Messina has appeared as an on-air home care and elder care expert on WNBC TV Weekend Today in New York, WABC TV Viewpoint, and WABC Radio Living Better with Laura Smith. She was also featured in several articles about the Visiting Nurse Service of New York's efforts during Hurricane Sandy. She has written numerous elder care articles for several newspapers and blogs. Ms. Messina, welcome to Your Money, Your Life. It's great to have you on the program.
Thanks, Ramsey. It's really great to be here. I appreciate you letting me come on and sharing the discussion with you.
Now, do you mind if I call you Lainie for the balance of the program?
I would love that.
Okay. Now, Lainie, there seems to be much confusion about the Affordable Care Act. You know, we're all familiar with the high-profile stories with regards to a broken website and people not being able to get their coverage. But we really haven't heard much about standards of care. What impact has the Affordable Care Act had on standards of care?
Well, you know, it's funny because you have read a lot of things about the Affordable Care Act, and I think when you talk to different people, for example, if you ask 10 different people their opinions on how it has impacted standards of care, you'd probably get 15 different answers. I think depending upon the day and depending upon the angle with which somebody is involved in the system, I think would really dictate whether or not they see it as something that's been effective and really has had an impact or not. I think that the thing that I can speak most closely to really is how I think a lot of organizations are trying to make a significant change in their standard of care. For example, you know, I think the first impact you're seeing is consolidation. I think that in the same way that the airline industry went through this, in the same way that the telecommunications industry went through, when new regulations come out, I think organizations look to get bigger to sort of sustain themselves over time and to be able to, you know, withhold themselves for what is coming, embracing themselves for change. So that has meant that some community hospitals have had to shut their doors and have been feeling the pressure to join, whether it's larger physician practices or joining the hospital system, and then they become employees as opposed to, you know, running their own business, so to speak. I did a lot of work with one very large, well-respected academic medical center in New York City, and we ran focus groups to really ask patients, both people who have used their system as well as people who had not and used other hospitals in the area, what they expected in terms of their experience in working with the hospital, and especially in light of, you know, all of the changes in the healthcare system. And the answer we most commonly heard was more around the idea of clinical knowledge and expertise, right? Medical competence is seen as table stakes, but it's really about what are you doing to make my overall experience stand out and be different, right? What happened when I was greeted at the front door, right? Whether it was I came in through the emergency room or I walked in for a scheduled appointment. What was that room like, right? What was the food like? How did people treat me? How did people communicate with me? Did people smile? Did people make me feel comfortable? I think the most important thing to think about is nobody wants to be sick, right? Nobody wants to need help when it comes to their health. But when you do, you have to acknowledge that somebody's got fears and they've got anxiety about it. And what are organizations doing to put the patient at ease and feeling like their needs really matter is important. In addition to all of that, organizations are looking at, how do I do that without cutting staff? Because cutting staff is obviously the first way many organizations think to cut costs. But you need the staff to treat people. You need new equipment to be able to diagnose patients. So then they're looking at things like, what are best practices across the hospital? What are best practices in treating heart failure patients, in treating people with, COPD or other pulmonary diseases? Overall, how to do that in a more cost-efficient manner. And a lot of that is what you could refer to as really looking at population care management.
With regard to population care management, is one of the ways for these practices to be able to handle the increased volume which you'll see through the Affordable Care Act by going out and hiring people like nurse practitioners and physician's assistants. Is that one way of handling that?
Absolutely. Those are two examples that you mentioned that are really growing, and the need will only increase over time. I think physicians are being expected to see more patients, right? A lot of the intent of the Affordable Care Act is to give all citizens access to health care, and making sure that you have the insurance to pay for that is a component of that. But when you walk in the door, right, you expect to be seen by a professional. And we've all had that experience where the physician walks in and they have 10 minutes with you, and they walk out the door and you feel like you've got a ton of questions that you didn't get answered, or you didn't get enough time to really understand what they told you. That's the beauty of a physician's assistant and a nurse practitioner, is they're a less expensive solution oftentimes than the physician's time, that him or herself. And they can spend that additional time with you. They have access, hopefully, to your electronic medical record so that they can see your history. They can see perhaps the medications that have been prescribed for you, and talk about things like medication interactions. They can talk about what you need to do in terms of follow-up, whether it's with a specialist or any testing, and what you need to do to make sure that you're managing your care once you leave the hospital, and then following up with you, because that's so critical today.
In preparing for this show, I spoke with what I'll refer to as the man and the woman on Main Street. And their concerns with regards to the complications associated with the Affordable Care Act will be, how do you go about cutting costs while still preserving quality of care and patient satisfaction? Their concern is that a realistic goal? Would you speak to that?
Yeah, well, I'm going to tell you that I think my personal opinion, and I think it's shared by others, the jury is still out. I think what most people in healthcare will agree to is our system needs to change. I think that the way our system currently works, we spend more money in taking care of people than any other country in the world, as far as I know. And we've got great advances in medical technology and research, but we need to do something to shift it. And the things that are being done, right, I think in the short term, in some cases, add costs. And let's use technology and electronic medical records as an example of that. To invest in new systems, to introduce software and hardware into a medical practice is an added cost. Once you've digitized all of your records and now you use it on an ongoing basis, there should be efficiencies in the long run. The reason I say that, the jury is still out on these things is because not every office, not every hospital, and sometimes not every hospital within the same system uses the same infrastructure or the same application, or uses it in the same way. So I think that presents lots of challenges, and I think that there's great skepticism around whether it will work. I think today we are in what we refer to as a fee-for-service industry, right? I pay for every visit, I pay for every test, I pay for every episode. One of the major tenets of the Affordable Care Act, in terms of some of these shared savings programs and pilot programs that the government has put together, is the notion of, I'm going to pay a bundled rate for you to manage that care. However you can efficiently and effectively do it, that's on you. So how you partner with organizations, where you send them for testing, how you analyze the results of that testing, and where you ultimately refer them, will hopefully then help you manage the cost of care over time. I think a lot of the providers, right, rather than, your Main Street people that are talking about whether this will work, the providers are saying when you come in and you are a medically complex patient, right? So a 70 or 80-year-old person who has multiple what they call comorbidities, right? I might be a diabetic, I might have a history of heart disease, I might have high blood pressure and high cholesterol, and then I come in and potentially I've had a stroke. The complexity of care for somebody like that drives the costs up, and providers feel they're being penalized, right? Taking a flat rate that I'm going to pay for every certain type of patient, they feel that that's unfair for them, but that they know that's their obligation, is I need to treat every patient. So I think all of those factors are why you'll never get a straight answer as to whether or not the current construct of the Affordable Care Act will really work. But I think all these different pilot programs and the inclusion of patient satisfaction is so that we don't forget that there's a human element to all of this. Many people who get into healthcare get into it because they want to help people, right? They want to do good and they want to help fix people. But it's also a business. It's a livelihood for a physician who's just paid for a very expensive medical education, or for somebody who's gone to nursing school or physical therapy school. And they now have to manage the revenue side of healthcare as a business with the human side. And I think that's where the patient satisfaction metrics come into play, is really looking at how the patient views how I'm treated, not just medically, but overall in terms of respect and communication and concern over the long haul.
Lainie, what I'm coming away with is that the Affordable Care Act is now taking and shifting the responsibility for efficiency to the healthcare provider. Am I hearing that correctly?
Yes, I think there's a very big shift to that, right? And that's where you see things, if you've read a lot about accountable care organizations, or ACOs, right? Those are primarily a combination of insurers, hospitals, and physicians. And they're all now working together to figure out how can they more carefully manage the amount of money that's spent to care for people with different diseases and diagnoses. And a large portion of that is focusing on, instead of treating only sick people, how do I keep people focused on being healthy and being well? And that's the part where, yes, the provider feels great responsibility and burden and has to create efficiencies, whether it's through technology or through, best practices in terms of both diagnosing and creating a plan of care for somebody and certain testing that they might do. But the patient bears great responsibility as well, and really learning to be your own advocate for your own health and wellness becomes even more important. So much of the costs still do fall to the patient, right? If you think about copays and out-of-network expenses, and then things that are just not covered, you have to think about, every time I go in and spend money, what do I want to spend it on, and what can I do to do things that are of a preventative nature, in the same way that the provider has to think about that.
Lainie, whenever I talk to members of the physician community about the Affordable Care Act, they always grumble. Mm-hmm. Can you talk about the concerns of physicians and other healthcare providers regarding the Affordable Care Act?
Absolutely. Well, as we said, their job is getting harder, right? The government or an insurance company is making a decision about how much they will be reimbursed. So they have to be financially savvy and understand the rules and regulations of all these programs to know what is and isn't reimbursable and at what rate. We talked about access, so they'll see more and more patients coming through their door. We still know today that many people are living longer, and that's a wonderful thing in our society, but it also brings with it that you're living longer and typically living with chronic medical conditions. All of that pressure of running a practice and trying to treat your patients, with the fact that patient satisfaction is now something that is being measured. And if I'm an oncologist and I'm delivering the news to you that you have, stage 3 cancer, how happy are you going to be when you leave my office? And if you think about many patient satisfaction studies, a lot of that is really about how satisfied, meaning how good did you feel about it? I may not have felt good about the news, but the questions that need to be asked and the reasons why I think doctors are frustrated is it does require them to have additional communication and to do follow-up and to do education with the patient, and that creates a big burden for them. However, I think that we all recognize that that's the nature things need to move to. When I'm picking a doctor, I don't know what you do, Ramsey, but I do ask other people. Word of mouth is very important. But I also go and check what their ratings are, whether it's on Health Grades or Yelp. And that's frustrating to a doctor. But if they manage their practice and they manage their patient relationships and they manage their reputation, in most cases, when people go publishing information on blogs and websites, it's the occasional bad experience that absolutely surfaces and it causes great anxiety for people when they read that somebody had a bad experience. But how you manage that and how you respond to it is really what's going to determine whether or not it becomes a positive or a negative for their business. And I think that having information and access is a blessing and a curse, but it's something we now have to live with. It's the nature of our world, right? Is that people go to the internet for information. And so it does put that burden on the doctor not to just be clinically competent and to know their expertise, but to be a human being and to take interest in those patients and make sure that they are educating them and arming them for what happens when they leave their office, and that they know how to do follow-up with that office should they have any questions or concerns.
First of all, there's no perfection in life, and so there will be mistakes. People will make mistakes, and I agree with you. It's critical how you handle that mistake, or I think the term you used was manage, how you manage all of that. Also, prior to the internet, doctors really didn't have to worry so much about communicating. Oftentimes people put doctors up on a pedestal. Well, I think that pedestal is starting to come down somewhat. Doctors are still very important. They're healers and they provide a very important service, but I think doctors are going to have to learn a little more public relations is the way I look at it. In any event, I want to move on to another topic. And you had mentioned earlier with regards to the Affordable Care Act is something that's going to take some time. But there are people out there that are skeptical whether the Affordable Care Act can work. Given your experience consulting with healthcare providers, do they have concerns about the changes under the Affordable Care Act? And if so, what are they?
Yes, well, there are definitely concerns. I think that while there's universal agreement, as we said earlier, about the idea that the system needs to change, right? Going from what has been an acute care system, right, dealing with people in the thrust of an illness, to really managing their chronic conditions and more sustainable and focusing on somebody's health and wellness. I think today there's a variety of different pilot programs that are set up, and not all of them will work. I mean, I think like anything else, right? Change is hard. Some people are more comfortable in an environment of change and some people are not. I think some organizations are better equipped to manage change because they have the right level of staff. And let's use it as an example that the intention of the Affordable Care Act, in the way in which they're now making changes to the reimbursement process, is really focused on outcomes. And where the skepticism comes in is you have to have data to support that. And you have to have the systems that capture the data to support it. So there's a tremendous amount of interdependency and complexity to all of this that needs to happen. One example I can use is I'm a 45-year-old woman. I had a fall in January, slipped on some icy stairs. I fractured my rear pelvis and I had a slightly herniated disc. Now, how my back specialist and pain management doctor treated me is very different than how he would treat an 80-something-year-old woman who has high blood pressure and who has had multiple falls and may be on medications for different diseases. Now, the system is sort of set up that, we would fit a different profile, but there's something to be learned around what worked and what didn't, both in terms of a medication regimen, the testing and how frequently testing might be done to see if the injury was healing or maybe not being done, and just checking in with the patient to make sure that they're doing what they were supposed to do and they are healing. And I think those are all things that over time, right, we have to be patient and be able to do the work and say some elements of this program aren't going to last. Some of them are going to be cast aside and said, we tried to make that work and it wasn't effective. But there are other things, and being able to be honest about those things and say, okay, well, if this piece worked, maybe if we tried this instead. And I think it's going to be an iterative process. And for people who are expecting that, overnight or even in a year or two, our system is going to change for the better, I think sometimes it might need to get worse before it gets better. But the framework is in place around the idea of wrangling costs and focusing on improved outcomes.
So is it fair to say that we're going to experience some growing pains with the Affordable Care Act?
Absolutely. We all are. And I think that, being knowledgeable, reading about things, knowing what's going on, asking questions about, your care, whether it's with your a family member who might be in the healthcare industry or with your, physician, him or herself. I think getting smarter about it and understanding how it's impacting him or her will only help you be smarter about how you manage your own care.
Now, Lainie, we've talked about the role of healthcare providers, but does the patient play a role in helping to make healthcare affordable?
Yes. I mean, if you think about it, a lot of the reasons why a patient cares so much, not only because I care about my health and my well-being, I'm often reaching into my pocket to pay for many of this. I have a copay when I go to the doctor. Certain costs of care are not covered under my insurance. Paying for my premiums, making a selection about what plan makes sense for my family. All of that matters. So if you can figure out how to invest in your own health and wellness, we all have risk factors for things, right? So as an example, I'm somebody who recently went through a health transformation. I've lost a significant amount of weight. I've invested in things like a Fitbit Flex, which is wearable technology that helps me track my activity level and looks at my sleep. And, I track my nutrition, and I've gotten to the place where I'm as healthy as I've probably been in 20 some odd years. That doesn't mean that something bad can't still happen to me, and that, I have heart disease that runs on my father's side of the family, and, other people might have cancer that runs in their family. But anything you can do to minimize your risks is smart. And so some of that is an investment. It's taking ownership. It's being an advocate. It's going into my physician, which I do, and getting my annual checkup and asking questions about my blood work and understanding what those numbers mean and what can I do to manage my care better. And when I'm experiencing a problem, yes, I'm one of those people. I will go on and I'll look on different websites and start to research. In the same way that I would research what doctor to go to, I want to go in with some understanding of my own condition so that I can speak intelligently to that physician when the time comes. I think those are all very important things, to be an advocate for yourself and for your loved ones, and know what to expect and know what your rights are and know who is best to match your needs and your care, I think is really important.
Obamacare is a health care law that was created to expand access to affordable health care coverage to all Americans with lower costs and improved quality and care coordination. Also, Obamacare's aim is to end some of the more loathsome insurance practices, such as discrimination against individuals with pre-existing medical conditions and arbitrary withdrawals of insurance coverage. Whatever your view, Obamacare is now being put to its biggest test as its signature insurance mandate has taken effect throughout the nation. Obamacare, no doubt, has its skeptics. Today we learned that the Affordable Care Act will impact changing standards of care. In this regard, Obamacare will shift the focus from an acute care system to a chronic care system. And oh yes, let's not forget Ms. Messina's comments that this change represents a significant shift. She opined that because everything new is difficult, change requires patience, time, and objective analysis in order to determine what is working and what isn't. Although the jury is out on Obamacare, most agree that our system of health care needs to change in order to ensure that our children and grandchildren will be able to afford health care. You can find more details about Obamacare by visiting healthcare.gov. In closing, thanks to my guest, Lainie Messina, for her participation on this program. Lainie, thank you very much.
Thank you, Ramsey. It was fun. I appreciate you giving me the opportunity.
It was great having you on. And as always, thank you to you, our viewers, for watching Your Money, Your Life. My name is Attorney Ramsey Bahrawy, building your trust.